patient has 2 lungs in a box.
Very excited to be reacting to House MD Season 8, Episode 2, Transplant. On this channel, we are reacting to all 177 House videos, and this will be episode 157. Let's see if I can get the diagnosis before House does as a doctor working in London.
Tell the dean that I don't want to see her.
He said you'd say that.
He? What's the hiring policy over there? All ass-based?
I can get you out of here. We have a crisis, which is good news for you. You're out tonight on conditional parole. The patient has 2 lungs in a box. Only has 12 hours left. No pulse, no body. It's your perfect patient. Surgeons had the recipient on the table when they realized the lungs had increased airway resistance. And we still have no clue what's wrong.
Nice painting. Totally offsets the stench of suffering and death.
Scam extra Vicodin, back to jail. I own you.
Yes, Maza. When did Cuddy leave?
She gave her notice the day after your incident.
Where's my stuff? What about my team?
Taub, Chase, 13, all moved on. There's your new team.
Hi.
Go back to neurology.
I can't. I punched my attending.
ARDS, secondary to trauma, is our leading hypothesis.
Any alveolar exudate?
No, lungs are dry.
And we idiots treated with broad-spectrum antibiotics.
Cocaine.
Tox screen was clean.
Coke never got past the lungs. We're gonna find the dead kid's stash.
We're not friends anymore.
My chest. Angina's back.
Is there a chance of locating another donor?
It's unlikely. The hospital brought in a consultant to work on the lungs. He is an excellent doctor.
Hey, we both assaulted our bosses. It's like we're twins.
How did they find the perfect assistant for House and at such short notice? She just happened to punch her attending on the exact morning House was on his way. Maybe she just knew it was the cost of entry to his team of 1. I probably shouldn't speak too soon in all fairness, since I still have no idea why she punched him. She doesn't seem like a person who would engage in workplace Wing Chun for no reason, so he probably deserved it. This team may disband soon though if they don't crack the great box lung mystery of season 8, so what do we know so far? The original donor was 19, got in a motorcycle accident, had all his other organs fail shortly after, and the issue with these lungs was that they had increased airway resistance. Well, it means that more effort is needed to blow air in and out of a lung. Imagine trying to blow air through an incredibly large straw versus an incredibly small one. Which would be harder? The smaller one, of course, which is why narrowing of the airways usually causes increased resistance, but that can happen for a variety of reasons. The muscles can spasm, you can have clogs from airway secretions, or structural changes. All of that needs to be figured out before the lungs are no longer suitable for transplant too. Usually that would be about 4 to 8 hours, but this lungs in a box situation can actually work in real life and has been reported to extend the life of them to 20 hours at most. It's called ex vivo lung perfusion, and it also involves tying them up to a machine to keep them nourished at the same time. So really we are significantly lacking in clues here, since all we have is a vague theory that it can be cocaine related, but with a negative tox screen. We might be able to get another clue though if we figure out what started the motorcycle crash in the first place. Maybe it wasn't drugs or alcohol and the bereaved biker actually had a condition that made him lose consciousness. His parents are still alive, so presumably they're unaffected, although that may not necessarily be the case. Oh, I actually have a good idea. What if he has a reversible scarring of the lungs that is associated with some kind of exposure that could have caused both the accident and the ongoing lung damage, and if they find out the cause, it's possible to reverse. The dryness does also point to that as well. Oh, in that case, it could be something like hypersensitivity pneumonitis with a specific trigger, like mold, bird feathers, smoke, or even dust. Oh, that would work so well here. All right, I'm going for hypersensitivity pneumonitis as my first diagnostic guess. Let's get more clues.
My boss dumped me, and yours, what, called you his China doll?
My boss grabbed my behind. It's my parents. If they found out what I've done, they'd be mortified.
I told you, my son didn't do cocaine. He was an athlete. Took real good care of himself.
Your son isn't wearing glasses in any of these pictures.
He just got them a couple of weeks ago.
He was having headaches.
Yeah, he was.
He had a brain tumor. Turns out, they monitor these monitors. I thought the bracelet was decorative.
I need you to solve this, and I need you to do it without making me look like I can't control you. For both our sakes.
We should probably leave the body in the bag.
There's a mass in the arm.
Your catheter bag is empty, despite taking in 200 cc's of fluids.
That mass wasn't a tumor. It was coagulated plasma. No cancer anywhere.
They're reacting to something in the plasma.
Can have up to 25 contributing donors. We need to track down all of them.
25 donors contributed to the plasma that the lung donor got.
Number 3 went to a baseball game the day before he donated. He ate a bag of peanuts. If our donor had an allergy, could explain the lungs.
Donor 6 traveled to Thailand around Korat. Region was endemic with dengue fever.
Oh, we have a good old treasure hunt, except House is a sitting duck and he just has Punch and Wilson, ex-friend Wilson, doing his chasing for him. Why? Well, they think that the patient's plasma infusion could have triggered this episode and the plasma could have come from 25 different people. So they need to know who they were and what they were doing. Would that be the case in real life? Well, yes, plasma doesn't have the same compatibility requirements as red blood cells, which means it can be pulled from many different donors. That potentially could be thousands, so if anything, this episode is underplaying this investigation. A win on accuracy points there. So far, we know that potentially peanuts are involved and maybe even dengue fever. Neither of those seem to be likely, since a peanut reaction that led to the patient's death would have been obvious with signs of anaphylaxis and urticarial rash. If it was dengue, then he'd have deteriorated over a much longer period rather than immediately, so that doesn't seem plausible either. If we know that the plasma is the source though, it would be very interesting if they check all the donors and don't necessarily find the clue, but instead realize that it wasn't an issue with the donors. Maybe there was a problem after the donation. I have a theory. Plasma is usually frozen for storage and then defrosted to be infused if during the thawing process there was bacterial contamination, as the water bath wasn't maintained properly. That could be the source of infection. It also means that House is able to take a jab at Foreman at this contamination, since he was somehow responsible as the Dean of Medicine. Oh, that would work so well, but what kind of infection could it be? There is a possibility that Pseudomonas aeruginosa could do it, and it can be easily resistant to the usual antibiotics we use, so even though they'd already given him that doesn't necessarily rule it out. Alright, I'm going for plasma contamination with Pseudomonas as my second diagnostic guess. Let's find out if I'm right.
Alcohol. Hey! Paint around them!
Who's painting?
They scraped off the underpass, probably because it contains
Lead.
How's the chelation going?
Reverend Moon started it about 20 minutes ago.
What round of chelation is this?
4th.
Oxygenating?
98%, airway resistance down. Dad, what are you doing here?
Got your text.
Lungs are crashing, I have to go. Chelation's making it worse, which means we're wrong about lead. Salien's flushing forward, but getting no return. One-way valve, vasospasm.
Calcium channel blocker should relax the artery. Vasospasm's relaxing. Left lung is pinking up.
Right middle lobe isn't. Killed part of the lung.
Sarcoidosis could be inflamed by the treatment.
ACE negative.
Maybe the problem isn't a heavy metal from outside. It's inside. Iron. Go stain the dead lung tissue for iron.
Your small airways are collapsing. You're not getting enough oxygen.
I'm done.
Enter!
It's a bathroom.
Explains the hole in this chair. Gotta have missed doors.
The patient signed a DNR. She's giving up.
You find another angle. You hold her hand, get the sister to beg, you do whatever it takes.
Dr. Foreman, would you look at this? White blood cells.
Infection.
Infection was the first thing that the transplant team treated for.
Which would have worked if the bacteria had been out in the open. I'm thinking brucella, antibiotics, and IVIG.
What are you doing here?
It was my idea.
Hail, hail, the gang's all here.
You were right to push me. I needed that. Thank you.
I like you. I have fun with you. Do whatever you have to do to get over this.
The thing is, House, I don't like you.
When did the discoloration start?
A few minutes after I started the IVIG.
Wrong about infection. I need ideas. Keep them stable as long as you can. I need to think.
Oh, House has had a realization, and I don't think it's that he needs a party hat. He sees smoke. What could that mean? Could it be like saying that there's no smoke without fire, meaning that they've been looking at the wrong place all along? Or could it be that he was actually directly exposed to some kind of smoke inhalation? That doesn't really explain it. Also, how are lungs crashing? They do not have blood pressure, heart rate to crash. I love this show, but lost accuracy points there. All right, so what is the smoke? Maybe it's the white blood cells that were found in the lung sample. If they didn't come from infection, then what else could they be? Oh my days. I have a theory. The patient got worse when the plasma was given. He also got worse when the IVIG was given. What do these have in common? Antibodies. That's it. That's why the white blood cells are the smoke, the signs of the reaction to the antibodies. Then what's the fire? The thing that caused those white cells to start accumulating in the first place. Autoimmune hemolytic anemia. The antibodies are given, that causes a cascade of events which causes the blood cells to break down, clogging up the lung tissue and leading to the lungs failing. That can ruin their architecture and cause them to fail early. Give steroids or immunosuppressants and then get rid of the old blood with new blood, and they might just be able to implant those babies. All right, I'm going for autoimmune hemolytic anemia as my third and final diagnostic guess. It explains everything. Let's see if I'm right.
The lungs are a smoker.
But the kid never smoked.
Plays poker without cigars. His white blood cells were special. They had an on switch for reacting to smoke, but no off.
Eosinophilic pneumonitis. But the steroids would have treated for that.
We need to hit it harder. Blitzkrieg.
But that'll destroy the good lung too.
Where do we go?
It's working. He did it. Dad, do you have a minute?
Thank God you called him.
House, got something for you. Found your stuff in storage.
Dinner later? I'll meet you at your place at 8.
House and Wilson are now ex-friends. Also, eosinophilic pneumonia. Eosinophilic pneumonia. That can be a manifestation of hypersensitivity pneumonitis, which was my first diagnostic guess, but they are ever so slightly different. Oh, so close, but still, I think House takes the biscuit on this one. When will I finally get one? Oh, these later episodes are tough. Great overall though, 8.2 out of 10 entertainment, 7.5 out of 10 diagnosis, 7 out of 10 accuracy with the whole lungs crashing situation. But this episode doesn't make full sense until you watch the previous one where House is in prison.